Missouri voters can now decide whether or not to expand Medicaid at an earlier date. Good evening, I'm Heather Lewis.
Good to have you along here at 10 tonight. I'm David Oliver. So Amendment 2 on your August ballot will be a yes or no question on whether to expand Medicaid. Color 10's Francis Lynn up first tonight with more on what this might mean for you. Francis?
Well, over 30 states in the U.S. have already expanded Medicaid, and today a group brought their ambulance named Marv here to Springfield to campaign for expansion. However, not everyone thinks it's a good idea.
Today, I made the decision to place Medicaid expansion on the August primary ballot.
Governor Parson announced today that if Medicaid is expanded, it will have to compete for funding with higher education, mental health, and public safety.
If you compare the Medicaid expansion to the conservation, to the transportation, to MoDOTs and their funding sources, or recently as medical marijuana, all of those had funding sources attached to them. Medicaid expansion does not.
But some believe this debate is about saving lives. The group Healthcare for Missouri made a campaign stop in Springfield today. Doctors say expanding Medicaid will benefit the poorest in our community.
The proportion of poverty-stricken and medically underserved people who are dying of this illness and in higher proportion than the rest of the population.
They wouldn't have to choose between whether they have food, utilities, or if they have the ability to go to the doctor when they're sick.
The group says the leading cause for bankruptcy in the U.S. is healthcare expenses.
So we're talking about our low-income, hardworking individuals cannot afford to go see a primary care doctor until it's too late, and now they have to go to the emergency room.
So what ends up happening is they get hit with a bill that they're never going to pay. They will pay on that bill for months and years and never get it paid off because somewhere along the line they're going to get sick again, or someone else in the family is going to get sick. It's a vicious, never-ending cycle.
It was such a striking and tragic situation that I was an early strong advocate for Medicaid expansion.
Doctors argued Missouri hospitals are closing down, most in rural areas.
This will help keep our rural Missouri hospitals open and protect our jobs, ensure all of our neighbors have access to health care no matter where they live.
If you're having a stroke or a heart attack, driving an extra 45 minutes or an hour away literally could be the difference between life and death.
The group is happy with the earlier election and hopes voters will help get it passed.
And I just pray and hope that this will pass and that it will be brought into our state so we can take care of our poor and needy brothers and sisters.
But this initiative may be halted by a lawsuit. The group American for Prosperity is challenging the validity of the Medicaid expansion. They claim the ballot initiative violates constitutional requirements since it doesn't have a funding source.
All right, something to follow, Francis.